My name is Jane Centauro, and I've been at Milford Regional Medical Center for 20 years, the past 5 years as a quality and patient safety specialist. Previously, I've had many years as a nurse at the bedside in critical care, emergency room, and perioperative settings. During the pandemic, my role in the Quality and Patient Safety Department changed from a surgical-focused quality role to COVID-19 priority work. My roles included assisting with the COVID-19 intranet set that included PPE guidelines and new protocols, along with supporting the convalescent plasma expanded access program as the research coordinator. In addition, I was responsible for completing all the mortality reviews during this time to assess for any opportunities for improving care. On review of these cases, I did not identify any cases meeting criteria for further risk or quality reviews, but what I did find through the snapshot of care that was provided to the 44 souls that lost their lives was overwhelmingly heartbreaking. What was clear that despite all the challenges this frightening virus brought, including the fear of contracting the illness and spreading it to one's loved ones, our staff delivered exemplary and compassionate care to both our patients and families. I was especially touched by the palliative care team's role in assisting patients and families in establishing goals of care and providing recommendations for support and comfort measures at end of life. It was evident that all of our staff was committed to doing what we do best, provide exceptional healthcare services with dignity, compassion, and respect. There were many examples of this exceptional and compassionate care found in my mortality reviews. I found documentation of nurses holding patients' hands at end of life, nurses assisting patients to FaceTime with their families, in one instance so that a patient could tell her daughter she loved her one last time. In addition, nurses facilitated compassionate care visits at end of life. There was one family story that was especially tragic and touching to me. This family included an elderly mother, father, and developmentally delayed son who all lived together in the community, who had the misfortune to all contract COVID and ultimately suffered great loss of both father and son. After completing the father and son's mortality reviews, I was so moved by the surviving mother, who, despite requiring hospitalization for her COVID illness and grieving for the recent loss of her husband, advocated and continued to care for her 53-year-old special needs son, as she had done for his entire life. Our staff recognized this profound love and commitment between mother and son and accommodated her wishes to room with him when they were both hospitalized. Additionally, our nurses, providers, care managers, and social workers supported her through both the grief of losing her husband and the difficult decision to make her son CMO as his condition deteriorated. On follow-up, I was pleased to hear that the mother is doing okay with a follow-up visit with her primary care physician in the past weeks. She states she has come to peace with her decision to make her son comfort measures only. She feels like he is in a better place and no longer suffering. She has a very supportive family, and she states her children call her constantly. Thank you for the opportunity to share my experience today, and I want to thank all the Milford Regional staff and volunteers for their strength and commitment in delivering exceptional care to our community during this time.